The vision of our Ministry of Health and our Minister of Health, and I say all our people, our Minister of Health is the Honorable Nicholas Steele. I think the Ministry of Health speaks of an enhanced quality of life, improved health status of all individuals, family, and communities alike. We seek to maintain a state of optimum wellness in Grenada. Driven by the philosophy, of course, of primary health care approach, using and utilizing healthcare programs and strategies. The Ministry of Health, as it is in Grenada, is divided into 3 programmed functional areas. That I would not go into, but I encourage individuals who are interested in learning more about the health care system in Grenada to go to our webpage, gov.gd. There you would find a picture of healthcare in Grenada. You would find that the Right Honorable Prime Minister, Dr. the Right Honorable Prime Minister Keith Mitchell, is a picture of health. He is a model of wellness. He strives to motivate and uses the platform of his office to encourage young and old alike to be health conscious. Therefore, it was easy for the Permanent Mission of Grenada to call to action the global community, call to action the United Nations. My partnering with the groups that have approached the mission became what I call the right thing to do. And therefore, I can speak about the Association of Professional Women on Rural Development. Now that group is somewhere far into Anambra in Nigeria, but they reached out. Then there is right here inside the United States the whole context of the Africana Women Working Group. So when the Africana Women Working Group, the Association of Professional Women and Rural Development, and the Permanent Mission of Grenada identify a number of partners. Among those partners include the medical practitioners that I've been speaking of. We can talk about Dr. Ada Okiki, Mimi, Bernie Denny, and of course, Lady Ada Dozier, who is instrumental in pushing this initiative. And we went to the celebrities. You know, I always feel that the media is a very important player in promotion of any social issue. But you have Nollywood and Hollywood, and in Nigeria you have the stars that are playing conscious roles in talking about healthcare, and we have the Stella Dumasas, who is very instrumental in pushing this through radio programs and other mediums. So, my dear friends, as I said, the UN is in the village. We're taking the UN to the village. We're taking the UN to help us launch My Sister's Health Watch. And we're doing it in the context of evaluating the Beijing platform on women's health. We're trying to develop a transformative agenda. And this launch of My Sister's Health Watch is a vehicle. And we hope that the momentum would carry through to villages and communities. And you, present today, are the messengers are the ambassadors, are the stakeholders in your clubs, in your medical institutions and educational institutions. And we were so blessed to have the presence of the Governor General of Grenada to demonstrate that the state of Grenada, Carriacou-en-Petit Martinique, is in the vanguard not only of national health, but as promoters of global health.
A practicing physician, a public health professional, a mother, a friend, and a sister. It does not matter which country you belong to, because the culture of humanity, of caring for sisters, is so strong that we all need to be focusing on it. And it's a grassroots movement. That's what we hope to have at the end of 1 year and 5 years, and later on 10 years. So maybe have a My Sister's Health Watch +5, +10, +15.
I'm supporting this cause because of the issues that we have, especially in the Africana communities. I've had the privilege of traveling to different countries in Africa and the Caribbean, and I've worked with a lot of young girls who have health issues that have been ignored, seriously ignored. A lot of young girls are too ashamed to talk about the issues that they face every day, from puberty to VVF, to cervical cancer, to HPV, not even knowing the meaning of these things and not knowing how or who to speak to about it. We have decided that it is time to come together and mentor these young girls, take care of these young girls, give them hope, and let them know that someone cares. Someone out there is saying to you, let's talk about this. We have to end this era of stigmatization where we have issues with young girls coming out with the real issues that they face, issues that come out of rape, and the Africana community is not understanding the implications of what it is that's going on. So we here are saying that we need to come together, give them a platform to talk about these issues, because most of them might not want to talk to their mothers, their grandmothers, but we are here. We are giving you a platform to talk about whatever health issues you're going through and try to find a common ground, try to find people that can help you in terms of helplines and everything we can do, setting up clubs, things that are fun for young girls, but saving their lives. Join us in this fight. It is My Sister's Health Watch. It is very important, and that's why I'm a part of it.
Women and our dear sisters, whether it be the girl child or woman, have unique issues from the health organs, their organs, to pregnancy, to menopause, to running public health programs like screening for the HPV or the cancers of different organs of the body. And we know that without actually addressing the issues and all hands being on deck, we will just be playing political football, and that's, this is no time for that, because the issues are real and they need to be addressed. So we're here to talk on it, come up with ideas, implementations of making sure life is better for our sisters and the better health care put in place to address the real issues that they're facing. I thank you very much.
And so, my dear sisters and brothers, my dear friends, my dear family, My Sister's Health Watch came up as an instrument, an initiative to help in contribution to Sustainable Development Goals 3, which has to do with well-being of women and girls across the world, most importantly, the Africana community. Over the years, we'll be saying a lot about women and health. The United Nations, through the Office of Secretary General Mr. Ban Ki-moon, have established a lot of initiatives. Every Woman, Every Child, the UNFPA, the World Health, maternal mortality reduction. All these are in contribution to help the health of women. Policy issues has also come up. The civil societies as well have done much in trying to ensure that concerns of women and health is seriously taken care of. My Sister's Health Watch came up as an initiative in contribution to the forthcoming Sustainable Development Goals. We cannot do anything. We cannot move the world sustainably. We cannot talk about development and growth if women's health is not given good attention. Therefore, as brothers and sisters, as members of the family, as people who are interested in seeing the world move further, interested in the future we want for this generation, let us join hands to ensure that women's health is brought to the top priority. Through My Sister's Health Watch, we are talking of establishing health clubs in educational institutions, establishing health clubs in universities or community organizations, in trying to educate, empower, provide necessary information on how to achieve sustainable health for every woman and girl. Through My Sister's Health Watch, we are trying to get to rural communities. A lot of women do not have money to take care of their health. Governments are not able to provide necessary facilities that they need to take care of their health. Through My Sister's Health Watch, we need support, we need partnership. We need contributions from the global community. How best to keep a woman healthy and more resourceful for the world we want. We've talked about empowerment of women. We've talked about gender equality, ending violence against women, and so many issues. There are also communicable and non-communicable diseases. A lot of ill situations are coming on revolving against women and girls. But the question is, how can we put this to a sustainable end so that the world can move forward? Take note that if women's health are not given good priority, we cannot advance the world globally.
Express my profound appreciation to the President of the General Assembly and the Secretary General of the United Nations for their supportive role, for their continuous engagement in the process of the promotion of the health of women and girls in the context of UN Women. I thank you.